Today we had the best minds in the room. We had people talking about innovation and talking about what we could do better, not just for our members, not just what we could learn for NIB and our members, but also what we could do to improve the health outcomes for all Kiwis.
We've had some wonderful presentations. The thing I've really taken away from today is that there are a lot of good things going on in health in New Zealand, but they're sure is not controlled by the government.
What I thought was really great about today is the encouragement for businesses and those working in health to get on and make the change themselves that they feel they want to see in our country. I feel quite energised about being part of that change.
But particularly I think what I'm going to take away from this is understanding how to move forward, and that we need to focus on our patients and delivering care directly to them in whichever way that means to the providers. And I think we must innovate or we will all die.
What I enjoyed about today was connecting with people who are, in a sense, outside the government system, creating their own innovation around their customers, their patients, their clients. And so they're not limited by the policy decisions or the bureaucratic decisions. They can just get on with it using their own resource. And what we saw today is people who are working with those families, individuals, whānau, iwi, to build their capacity, use their data and information to create better services. It actually was quite inspiring to see how much can happen and how much improvement can be made independent of the political environment.
Ngāti Whātua Ōrākei is really privileged to be able to attend today and to be a part of the conversation around health innovation and solutions for the future. So we've come here today to talk about the partnership that we've got with NIB, and that is a comprehensive health insurance program for Ngāti Whātua, which essentially seeks to improve the health circumstance of our people over time. Toi Ora is the name of the program that we have co-designed with NIB. So we have essentially removed all barriers of cost for our Ngāti Whātua Ōrākei population. I think there is no Māori in this country who says having choice to access the best care in this country is a bad thing, and that's essentially what we've been able to do.
Yeah, well, I thought today was a great opportunity for people in the industry to come together and share thoughts on how we might improve the healthcare system. I have my own theory that real reform to healthcare will come from the bottom up rather than the top down, which is not to say legislators and policymakers don't have a role to play. You know, as a company, we're all about improving the health and well-being of our members and the communities in which we operate, and there's probably no better example of that in New Zealand than the important partnership we have with Ngāti Whātua Ōrākei, where we're trying to improve people's health at a population level.
Well, today's summit was about finding solutions to our healthcare crisis without actually going to big healthcare reforms. And actually we got just that from our speakers, because our speakers were really good telling us practical stories, on-the-ground stories of how they improved healthcare outcomes without waiting for politicians to do it for them, without waiting for the grand reform to fix everything. And just to hear this on-the-ground experience of what is possible within the current system is fantastic. Health reform and health outcomes, it's something that not any party can do in isolation. You need partners, you need to work together. We need politicians, obviously, but we need to have civil society, we need Maori, we need companies like NIB. And by working together, we can actually improve the outcomes for everyone in this country. And this is why it's so important to build strong coalitions of stakeholders, of partners who really come together to work towards the same kind of goals.